going to discuss the topic, impact of COVID-19 pandemic on global and South African economy. To guide us as lay people on these discussions, I've invited esteemed economists, Mr. Duma Kobule, and also Mr. Sandile Swana. I'm sure both gentlemen, you are familiar with them because they commentate a lot in the media on matters of economics. So we are grateful to have them here today to actually come and share their insights and make life easy for us to interpret matters of economics, which can be quite difficult for some of us. Mr. Swana and Mr. Kobule, welcome, and thank you for gracing us.
Thank you very much.
Yeah, that light for you, Mr. Kobule, just keep it right there. Sometimes I can see you nicely.
Okay, yeah. I can move to somewhere else where there's better light here, if you don't mind.
Yeah, because sometimes it changes. But anyway, welcome to our digital health platform. This is a platform that I've created for us to be able to deal with various issues that are of concern in the country. The biggest issue at this moment is the issue of COVID-19. It is an issue that is facing the whole globe, and South Africa is not insulated from it. So the discussions today are not going to be clinical discussions, but it's going to be discussions around issues of economics. So the purpose is to make sure that we unpack for lay people the economic impact of this 3-month-old COVID-19 pandemic. What is it doing to the global economy? And what is it doing to the local economy in South Africa? So I'm going to ask questions from the two of you gentlemen to help us, just understand what's happening. And the first question, I'm going to pose it to Mr. Kobule about the global economy. What is the impact of this COVID-19 pandemic to the global economy? The next question will be directed at Mr. Swana, which is in the South African context. Pre-COVID, how was our economy in South Africa? And Mr. Kobule, pre-COVID, how was the world economy? All right, so let's start with Mr. Kobule. How was the world economy before COVID?
The world economy over the last decade, I think it's grown pretty fast. It's about 3.3% of per annum over the past decade. And the South African economy has grown by about 1.4% over the past decade on average. So the economy on per capita terms, once you take into account the population growth in South Africa, hasn't grown for 10 years. So that is what I call the lost decade in terms of economic development we've seen in South Africa over the past 10 years. Now, going into 2019, before this black swan from Wuhan came to our country, wreaked havoc on world economies, the economy was generally, the world economy, there was a positive outlook for it because people were looking at the resolution of the trade deal between the US and China, which had resulted in a lot of what you call positive sentiment on world markets around the prospects for the world economy. So it was a generally benign environment for the world economy, and it was a black swan event. Nobody expected it, and that is what has happened here.
Yeah. All right. Let me switch to Mr. Swana. Your mic, Mr. Swana, seems to have been switched off. Mr. Swana? Is it on now?
Yeah, yes.
Yes.
It is on.
All right. Can you tell us before COVID?
Let's deal then with let's deal then.
Yeah, Mr. Swana?
Let's deal then with the South African. Yeah, I'm here.
Yes.
Let's deal with the South African economy before COVID.
Yes.
The South African economy had been struggling since the 1970s to grow. It was during the Mbeki presidency that the economy started to grow. It reached a maximum of about 5% per year of growth towards the 2008 crisis. From the 2008 crisis, it started sliding down. In the past 2 years, it slid down significantly. As you saw the results of the last quarter of 2019, where the growth actually proved to be negative, and the whole of 2020 before COVID was going to be negative. We're already in a technical recession before the lockdown. So now,
yes, the network for Mr. Swana is a bit challenging. Can you hear us, Mr. Swana? All right. Whilst Mr. Swana? All right. Mr. Kubule, I think let's Mr. Swana, can you hear us?
hello? Yes. Yeah, I can hear you.
Yes. So you were still telling us about the economy of
Can you
South
hear me?
Africa.
Yes, so now let us look at it. We're already in technical recession this year. Number one. Number two, the best estimates, we're starting to say we will enjoy at best 0.5, 0.5% of growth in the coming year. And all that COVID has done is to worsen that, to reduce it further. As to the extent to which it reduces further, we cannot tell you. Now, what I want to point out are a few basic things. Number one, in South Africa, even the past 25, UCT has started to measure this thing in depth. The 75% of the population of South Africa lives precarious lives economy, what you can call it from check to check. That's the extent of their financial safety. So only about 20 to 25% of the population in South Africa has got any form of economic security where a person can know that this year will finish and I will be fine. Others live day to day by that. So the second thing to consider is the level of unemployment. The second thing to consider is the level of unemployment, which is about 10.3 million people. And the people who live below the upper bound poverty limit are larger than the population of Mozambique, which is more than 31 million. So I think that is the state of the South African economy before COVID, and then we can go into the other factors.
Yes, no, thank you very much for that contribution. So what you are pointing out is that the economy was already breathing through the wound before COVID. And so what COVID is doing is actually going to worsen the situation. Mr. Kubule, can you come back to us again? So in February, our Minister of Finance announced a budget, you know, for the country for the 2020-2021 financial year. There were a lot of projections that were made there about how our economy was going to improve. Now, with this COVID-19 pandemic and what it has done, how relevant is the budget that was actually, you know, announced to the nation, which was meant to actually appease the rating agencies that have now, you know, obviously Moody's being the last one, that has just downgraded us. So can you just tell us a little bit the numbers or the budget that was, you know, released? Is it still relevant today, or does the government have to go back to the drawing board?
Okay, just quickly, I just want to talk about the pre-COVID situation, then the budget. So we've had 3 recessions in 10 years. Since President Ramaphosa became president 2 years ago, we've had 2 recessions in 2 years. We've had 5 out of 8 quarters of declining GDP and 6 out of 8 quarters of declining investment. So we had a technical recession the last 2 quarters of 2019, and the forecasts were for a 3rd consecutive quarter of declining GDP first quarter of 2020. This is before COVID came, and it was largely due to the load shedding. Now, in terms of the budget that came end of last month, is that the budget had austerity measures of about 260 billion rands. These are budget cuts in terms of mostly to the public sector wage bill of 161 billion. And by coincidence, the 161 billion rand that they were going to cut from the wage bill was exactly the same as the money that was going to use to bail out SAA and the state-owned companies. So the workers were being asked to pay for a mess that they didn't create. And it was actually taking money out of the workers' pockets to pay SAA and ESCOM, which they didn't create. So in terms of whether that budget is relevant, I think it's totally irrelevant right now, because the budget was based on an assumption of GDP growth of 0.9%. And at the time, we already said that that estimate is way too optimistic. Now, the situation with COVID results in a shutdown of GDP, 2/3 of GDP over 2 months. It is expected to impact on 80% of workers who won't be at work. This will result in a humanitarian catastrophe. So the estimates that you're seeing, that it will have a hit, according to my estimation, of GDP of about 600 million, the direct impact on GDP, because we're shutting down the economy for 2 months or 3 months. And once you take into account the secondary impact of that calamity, the hit to the economy could be about 900 billion. So the forecasts for GDP growth for this year are between -5% and -10%. Now, if you compare that with what happened after the global financial crisis, we had a GDP growth of -1.5%, and we lost 1 million jobs between December 2008 and March 2010. So now what we're saying, the best case estimate currently is that we will have a collapse that is 3 times what happened under the global financial crisis, and we could see 3 million jobs lost over the next couple of years because of the COVID calamity. So that is what the situation, what it does to our economy. Now, let me just say something. This is something that has never happened in my generation or my parents' generation. People talk about a war economy, but this is actually worse. There are similarities with the war economy, in the sense there was a reduction of supply of labor, which went to fight in support of in the war. But people came into the war economy, women came into the economy, Black people came from urban areas during that war, and there was some kind of a war economy. It wasn't a bigger hit, I don't think, as what we're seeing today. And globally, many people are saying this is the worst hit to our economies in generations, because there's never been in the history of economic thought a situation where you deliberately slow down the economy to address an epidemic of this nature.
Yeah. Mr. Swana, would you want to just come in there as well and just share from your perspective, or expand on some of the things that Mr. Kubule has spoken about the impact to the ordinary man on the street who was unemployed and marginalized from the economy, the households that were struggling, the small businesses that have been struggling. We've been told that small business is the future of our economy. Now, what does all of this do to small business? What does it do, to those who are still looking to get into the economy? The graduates that are unemployed, or other people who've been unemployed, the households that were below the poverty line. So what do you think is the impact there?
No, the impact starting from May this year is going to be devastation, economic devastation in people's homes. This devastation starts from the fact that every month people have got to pay rent, people have got to pay bonds and so on, and house bonds, car loans and so on. And a lot of these people are not financially secure in the first place. They don't have cash reserves. Now, this month, just for what is required in this month of April, to stay at home and do nothing between March and April, is eating up reserves that do not exist. South Africa is not known for savings, and 75% of the population don't have any reserves of any kind. Secondly, in South Africa, people should not be asked to look for jobs because there are no jobs. And the reason why there are no jobs is because people talk about GDP, lack of GDP growth and GDP decline. What that means is that we're not building up enough new businesses, enough new factories. So I also looked at saying, what has been the rate of bankruptcies in the previous economic crises that have happened before in 2000, 2008, and more recently? So you'll find that as this crisis is kicked in, you have about 200 bankruptcies a month. I think this might have about 3 times that number in the next coming months, many a matter of months. That is why you are going to have nations like Italy and other nations saying, guys, this whole idea of people paying bonds, paying loans, and this must come to a halt. So I agree with the view that the budget itself is irrelevant. It's an academic, whether you are trimming this side or trimming that side, the budget itself is irrelevant. Secondly, people who are running banks today, who are expecting people to be paying loans during this period or even this year, are joking, because people are going to be going, households are going to be going bankrupt. So we need to find a new strategy that has never been tried before of saying, how do you stabilize expenses? Yes. How do you stabilize homes?
Yes. All right. Just on that point, let me get back to Mr. Kubule. Mr. Kubule, from big business point of view, or industry point of view, what do you think is the impact? A few days ago, I listened to a clip of the CEO of Edcon, a clip that was quite worrying about the fact that this could not have happened at the worst time for Edcon that was trying, to get back to a healthier state. Now, I'm sure Edcon are not alone in that kind of situation. So from your view, what do you think is the impact of COVID-19 epidemic, the shutdown that we are in now, to businesses that were marginal, that actually were saved, with some of the monies or the pensions from the public service, workers through the, what do we call it now? Through the PIC.
Now, if that can happen to a big company like Edcon, imagine the rest of South Africa. So there's 2 issues I want to talk about here, is that we're going to see a graveyard of failed companies, large and small. I've already seen about companies like Kaya FM reducing their staff by about 37. Company after company, I just can't remember the name. Before this COVID-19, we had lots of retrenchments. So as Mr. Swana is saying, there'll be a massive spike in bankruptcies and companies filing for business rescue. SA Express has filed for business rescue. SAA is following. And I'm also worried about the financial solvency of Eskom. We've seen since last week, there was since this thing started, a massive decline in demand for Eskom's, for energy. And that's going to have a critical impact on Eskom's revenues and Eskom's accumulating debt. So I think that the government has been delaying this whole issue of restructuring the balance sheet of Eskom. So this will accelerate the situation. And I've been doing some studies on the unemployment insurance fund. They've got a huge surplus at the moment, but the need to pay out increased benefits for the unemployed is going to, I believe, have a big impact on the solvency of this fund as well. So it's going to have impact throughout society. If you read about the impact of the Great Depression in the US, you had people, hundreds of companies, hundreds of banks collapsing. So that is the type of scenario we're going to see. And in terms of the relevance of the budget, I should just talk that many countries now have been having emergency and supplementary budgets. Germany now, they had a budget recently. They've decided to have a supplementary budget where they pledged more fiscal stimulus. And Japan, the same, they're discussing a new fiscal stimulus. In Singapore last week, they decided that the money they'd set aside in the budget last year, they tore up their budget and they increased the fiscal stimulus to about $38 billion from $4 billion, And Malaysia as well, they're quite similar to South Africa in the sense that the economy is a similar size to South Africa, and they've got a former prime minister who's facing corruption charges on a much on a bigger scale than what we saw with the Guptas by huge amount, yeah. But anyway, so it's called the IM1MDB scandal in Malaysia, where the president suddenly saw money coming from into his bank account. I think it was a few $100 million, sorry, and he said he didn't know where the money came from. So this is Malaysia, but Malaysia announced a what you call it, the fiscal stimulus in Malaysia they announced was 53 billion, and this is after a change of government. And the previous government, a few weeks ago, they announced a package of 4.8 billion. So the Malaysian package of $58 billion is 16% of their GDP. So so I'm just saying that in Kenya as well, they announced a supplementary budget. So I'm just adding to what you're saying, that the budgets that have been drawn up throughout the world have become completely irrelevant because nobody saw this coming.
Yeah. Now,
and we as well rewrite that budget, because I heard the DG, he's saying, I'm going to take from travel budgets and put it here. That's not going to work. We need a fundamental redoing of the budget here.
Yeah. Now, just on that point, you know, we've been having a number of SOEs that have been, you know, in trouble, that have been requiring assistance, you know, at regular intervals, like SAA, you know, and others. So do you think the government is going to have any money to actually, you know, continue to assist such, you know, businesses that are not doing well, you know, the state-owned businesses? Mr. Swana, can you maybe answer that?
Yes, I think that let's start to where we were before this whole crisis started. Our view before then was that the budget, the balance sheet of South Africa is not being studied as a whole and not being used as a whole, and in a manner that countries in our circumstances that need to stimulate the GDP growth, because there is nothing that will solve the problems that we're in, including this COVID one. Afterwards, you still need to deal with the what you call with the GDP growth. So those entities such as ESCOM, let me make a specific point. 0.35 of the GDP growth per annum was supposed to come from Medupi power station. 0.35, and we're saying the whole country will grow by 0.5, and now it's going into the negative. So those things have got a lot of power to generate our economy, but we need to look at the whole balance sheet. In the balance sheet, there is space to do a lot of things, and through the Reserve Bank monetary policy, there is a lot of space to do things. So
yes,
we need to relook our thinking altogether.
Yes. Mr. Kobule?
I just wanted to add one thing on small business, because I was on a webinar with a lot of experts yesterday, and it went on for about 3 hours. And one thing they were saying is that they're going to, I'm not an expert on this, but they were worried about the issues of food security because of what's happened with the spaza shops, the informal businesses in the townships. And they're going to push for a change in the regulation to allow them to trade and provide basic food services to the people in the townships. Because what we're seeing right now is that the Unemployment Insurance Fund is going to provide some kind of benefits to the contributing members, but the Unemployment Insurance Fund doesn't include informal workers, doesn't include the people who are at the front line of the economic fallout from the COVID-19.
Yeah. So
you could perhaps have resumed, if the challenge, the court case succeeds, you could have some kind of resumed activities by these small businesses, but with conditions up around social distancing and so forth.
Yeah. So to an ordinary young South African who has just, you know, finished tertiary, who was busy looking for a job, this whole COVID-19, you know, impact on the economy in South Africa, should they look forward with hope, or should they actually look at different ways to survive? Any of you can just take the question. So what message should we be giving to those who are outside of the economy? They've got skills, but they had not yet secured jobs.
Thank you. I think just quickly, with 10.3 million people already unemployed, and probably give or take 600,000 new entrants into the job market every year. This year, we will move probably from 10.3 closer to 11 million. I'm sure Kabule can give you even a better number. So when I said it's not about polishing your CV or anything, young people now need to develop the spirit of people like Bill Gates and others, Elon Musk, to say, what is it that can come out of me to create new business? That is where the thing is gonna go. There is no space in the existing businesses for young people, none whatsoever.
Yeah, but then for them, for the young people to look at entrepreneurial ventures, there needs to be a support system, you know, for them to be able to start those ventures. But where are they going to get that kind of support? Because it's not been forthcoming. A lot has been said about entrepreneurship, how to grow it within our South African context, but there hasn't been much support. You know, issues of funding and other, you know, red tape that one normally finds. So how is the government going to be able to assist in that kind of direction? If we're saying there's no jobs in the formal, you know, in the formal market, people must create jobs for themselves.
I just want to say on that thing, you know, it's a one hobby of mine. I feel strongly about this. Is that I haven't actually found time to do actually all the research, but the situation is as follows: that there's very little funding for small enterprises in South Africa. It's almost like non-existent. So if you look at CIFA, it's about R1 billion a year. The IDC doesn't provide for small businesses. So what you call the land bank doesn't provide for small emerging farmers. Most of it goes to large farmers. So, and then you look at the four banks. The four banks, their commitments they made under the financial sector charter, they're spending a minuscule amount of money on small Black-owned businesses. So, so really, and then if you look at the value chains of the large companies, the ones that are open, like your Pick n Pays and Spars, they're procuring very little from emerging Black farmers, because that whole value chain, and Mr. Swana knows it better because he's a farmer. So the whole value chain from farming to food processing to the supermarket store, it is entirely white-owned, and there's no Black participation in that value chain. So I think that if we're serious about transforming our economy, we have to find ways to include Black people in every single value chain. And the ones that are open, I think people have noticed, and that the people who are benefiting from these retailers are the least transformed companies in South Africa. When you look at Pick n Pay and you look at their BE certificate, I once wrote about it, is that it is absolutely shocking, the lack of commitment of all these large retailers towards transforming the economy.
Yes. So now let's just bring it back to COVID-19. So in South Africa, we are currently in the lockdown. And the thinking there is that we need to reduce the number of people who are getting infected or those who are spreading the infection. That's why we are forced to stay within our homes. Good idea. But now, if that doesn't work well, as we have seen in the visuals, that in some parts of the country, people are not abiding by the rules. So in terms of the goals of you know, flattening the curve, we may not do that well. And the end result of that is that we'll have a lot of people who are infected, who are infecting others, and that will put a strain on our already challenged healthcare system. Now, what that means is that our Department of Health, nationally, but specifically the provinces, where the delivery is happening at provincial level, what needs to be done, because they have to employ more staff. As we have just seen, the Department of Health in Gauteng has now issued what they call e-recruitment drive to try and employ more nurses, more doctors, more every healthcare professional that could be of use, because in Gauteng, we are in the epicenter of COVID-19 in South Africa. And so Gauteng is the one that is feeling already the pressure of you know, this COVID-19 epidemic. Now, my question to you, gentlemen, is money needs to come from somewhere to buy to capacitate the hospitals for that 20% that may become severe in terms of the COVID-19 infection. For those people who need ICU care, for those people who may need ventilators, we don't have enough ventilators, we don't have enough ICUs. So to try and and improve the capacity of our both public and private, money needs to come from somewhere. And I'm focusing on public because 80% of our population is reliant on the public health sector. Now, where do you guys think the money is going to come from? Yes, we know that in terms of expenditure, or the budgets, education normally has the biggest cake. Health normally has the second biggest cake. But when you look at that budget of health, maybe 70, 80% of that is actually paying for, staffing. And there's very little for new projects and stuff. So with this COVID that was not budgeted for, where do you think the money is going to come from? Any of you can answer the question?
I think Kubule should address the issue of the balance sheet, because my worry has been that all of us, like in your home, when you want to talk about anything that needs to be funded, you don't only look at your income right now, you also look at what assets do I have.
Yeah.
And that is the area that has not been discussed quite thoroughly. And also the role of the Reserve Bank. In what must the Reserve Bank do? When
Yes.
Japan, for instance, came out of World War II, people had absolutely nothing. The banks were bankrupt, everybody was bankrupt. And the Bank of Japan, which is the Reserve Bank of Japan, went and just bought all those non-performing loans from the bank and recapitalized the banks, and Japan had money. So I think that we need totally new philosophy of thinking of how we're going to finance this. We have to accept we're in a state of disaster, not pretend to be anywhere else, but in the state of disaster, and we're starting from scratch. So to me, we need to also ask what is in the balance sheet exactly and how we're going to deploy that balance sheet. Secondly, what is going to be the role of the Reserve Bank? I would put it that way, because I think the money comes from two sources.
Yeah. Mr. Kubule, let's get into this point of the Reserve Bank in South Africa. In some of your writings, opinions in the newspapers, you have been saying that they are quite conservative in their approach, and maybe they need to look at things differently. At this point, what do you think is the role of our Reserve Bank? Yesterday or this morning in the news, we were told that the president instructed the Minister of Finance to focus on structural adjustment programs or something like that. What is that? So can you just, for us, the role of the Reserve Bank in terms of what needs to happen going forward? I know that there's been a lot of debate about its independence, and all of that. Now, but what you see in other countries is that actually there's a close working together of the reserve banks and government to chart a way forward for the country. Now, in the situation that we are in South Africa, what do you think should be happening to that independence? And what do you think they should be doing as part of a solution to the problem that we find ourselves in as a country?
Okay, I first want to talk about, I agree with Mr. Swana about we have to look at our whole balance sheet. So now, on the other side of the balance sheet, we've got a net debt to GDP ratio. It's basically your debt as a percentage of your income, if you want to look at it in an easy way. It's about 57% of GDP, and it's 2.2 trillion. That is not a large number when you compare it with other middle income countries. So in most cases, the debt to GDP ratio, it doesn't mean much, because how can I put it? It's usually a symptom and not a cause of a country whose economy is not growing. So what happens is that if your growth rate is less than the cost of capital, your debt to GDP ratio goes up. So we have to focus on increasing the growth rate of the economy. That's the first thing. Now, the second thing in terms of the role, in terms of the balance sheet, we've got assets of about we had assets of about 2.2 trillion in the Public Investment Corporation. The Reserve Bank also has foreign exchange reserves, I just checked now, about 800 billion rands. So that is part of the assets that we have as a country that Mr. Swana is talking about. So you should not just look at the one side of the balance sheet, you should look at the other side. For example, my father, he couldn't go to Hilltown back in the day. So he went and told his son that, no, you can't go to Hilltown because Andina Mali. And guess what? His mother, who had passed on by then, appeared in a dream and said, no, umntwana funeka aye esikolweni. So he went and liquidated the Kubule balance sheet and Wateng Sinkoma, and the kid went to whatever. So the money wasn't wasted. He went on to become the first Black African to get a PhD at Rhodes. So that is how we should see these issues. You know what I'm saying? So now, and then back to the Reserve Bank. The Reserve Bank's role is not just to set interest rates. This is where South Africans get it wrong. In other central banks in the rest of the world, the Reserve Banks, the central banks have a role in terms of growing the economy, in terms of, they also have a role in terms of production in the economy, and they use all sorts of tools. Let me give you an example about the downgrade. The downgrade, if there's an exit of capital from South Africa, the Reserve Bank can easily purchase the bonds of the people who are leaving to keep the cost of capital down, number one. They can easily introduce capital controls to police the money exiting the country and the money coming into the country under emergency measures. It happens in all countries that are faced with such issues like a downgrade. So the Reserve Bank can manage the fallout from this downgrade. And then the second thing about the role of the Reserve Bank, I was right in the beginning of this crisis. The People's Bank of China introduced a facility to support health facilities. The Nigerian Central Bank, 2 weeks ago, they also introduced a line of credit to support health facilities. So they would provide facilities to public and private facilities to support. Now, this goes back to what you were saying, is that when there's an earthquake, the first priority is to take care of the sick. So what the government must do then, it must provide the finance to plug the gap between available public and private health resources and what is required. It must mobilize personal protective equipment, the masks and the gloves, medical equipment, as you said, the ventilators, the beds, what else? The ventilators.
Yeah,
the beds.
I mentioned that the hospital beds, you know, for those who need to be admitted, the ICU, the ventilators, and all the specialized, and even employing more people to actually come in.
And the health facilities as well. People were saying in the webinar I was in yesterday that you need to set up emergency health facilities. And my niece is in New York, and they set up part of a university as a health facility.
Within 10 days.
Yes, New York. And then China, as you know, they set up new hospitals, which they've closed. And you know that in Indonesia, over the weekend, they converted a stadium into a temporary health facility. So those are the type of things. So what people are saying is that the government might have to take over some of the private sector wards and some of the private sector hospitals, as we saw happened in Europe, I think it was in Spain or something, where they nationalized all the private healthcare. So I'm just saying that the emergency measures that we can say, and we need to pool our public and private. So the golden, what's it called, the silver lining that may come out of this is an acceleration of the implementation of the national health insurance. And a friend of mine last week was telling me that the reason that prompted she knows it better than me, the starting up of the National Health Service in the UK was that there were a lot of servicemen who were coming back and they were very sick and they had to be treated. So they had to start taking over public facilities and they couldn't make them pay because they'd gone to fight in national duty. So they had to open the doors of all these facilities that they had, and that is what accelerated the
NHS.
Yes, and I just have to quickly mention about the NHS in the US. People in the US and the UK during the war, the public debt the budget deficit was 20% of GDP every single year during the war, and it spiked at about 26% in the US. But the debt to GDP ratio in the UK was 250% when they decided to implement the national health insurance. So they didn't first say, we have a high debt, we can't afford it. They said, what is required for our country? We will sort out the money later. Do you see what I'm saying? Yeah.
Yeah.
That's what's happening.
Yeah. So, Mr. Swana, would you want to come in again around, you know, the Reserve Bank issue, or we should move on to what have other countries done, you know, that could actually give us an idea of what our country must do to deal with the economic impact of this COVID-19?
Yes, thank you. I think I just want to make one straightforward statement about the issue of the Reserve Bank. What is never discussed openly with people like yourself, Dr. Nyandi, is that a Reserve Bank can actually create money. Like just create it and make it to come into existence. So that is something that we need to keep in mind as we discuss. Then the next thing that if we're to
just on that point, you see, I'm a layperson. I don't know these things you're talking about. But I remember people when our neighbors were creating money, Zimbabwe, you know, it created problems, right? So won't it create more problems for us when you do that? And I'm talking as a layperson here.
Can I try?
Exactly. So that is why I'm putting it there. Yeah, I think let's give Google a chance, then I'll come back. I've got a few points to make.
No, okay, sorry to interrupt, Mr. Swan. So people misunderstand what's happening in these countries. So now, what happens, hyperinflation is usually something that starts on the supply side of the economy. So in Zimbabwe, there was a collapse of production because of accelerated land reform. And the same thing happened in Weimar, Germany. It was something that started on the supply side of the economy. But anyway, just to get to the point, Mr. Swan, I agree 100% with what he's saying. So the Reserve Bank, you know, I was in China recently, and the Reserve Bank, they print a lot of money. A lot of what you see in China was financed over the last decade. They have, so a lot of it was involved printing money, supporting the development finance institutions, supporting businesses and so forth, yeah. So the thing is, there are different ways in which you can stimulate the economy. Let me just give you two scenarios. The central bank can provide money to the IDC to invest in Black businesses or industrial businesses in general. Now, because there's corresponding production that goes with that money creation, it shouldn't be inflationary, if you understand what I'm saying.
Yeah.
Number two, they can finance government infrastructure spending because that would be finance, it would be providing money, new money, which is result in corresponding production. So that is not inflationary. And then, but in the current situation, it's unique. We will have to, because we have deliberately slowed down our economy. So what I'm suggesting now is that there is a normal fiscal stimulus. You asked me what other countries have done. First of all, there was a graph that came out by the Overseas Development Institute, which I shared with some of my friends. And it showed the COVID stimulus as a percentage of gross domestic product. And then the top was the UK, monetary and fiscal stimulus, 19% of GDP. And that is a huge number. South Africa, 0.1% of GDP. And then you try to zoom into that graph and you can't see the South African contribution. So what I'm trying to say is that our contribution has been very limited. And as Mr. Swana is saying, so what I think what we need to do, this is a temporary situation. Best case scenario, 3 months, worst case scenario, I don't know what the worst case scenario is, but in the interim, we just have to, in 2020, we have to protect incomes and the people who are vulnerable. So what other countries have done, the UK has protected the income of 75% of wages. So if you get retrenched, the government will pay 75% of the wages. If you're retrenched forever or retrenched temporarily. Denmark, 80% of wages. I was looking just now, the Singapore stimulus, they cover 25% of your wages, but if you're in other industries, 50% of your wages. And then in Hong Kong, they also cover 25% of your wages. And all these countries in Asia have also found unique ways of distributing cash to their citizens to stimulate the economy. For example, in Hong Kong, at the end of last month, employees got a check of $1,300 in their bank accounts to help them go and spend money in the economy to stimulate the economy. So what I'm saying is that in this temporary phase, I don't know how long you medical people are going to tell us how long it will take to flatten the curve. In the meantime, we should be providing social security, some kind of social assistance to the vulnerable people in our society. And I believe that the stimulus has to be about 600 billion rands, which can be financed through our reserves or money creation by, it will obviously be temporarily inflationary because there's not enough production on the other side, but hopefully once things normalize, we can resume normal production.
Yeah. Mr. Swana,
Yeah.
if you were asked to advise the president, the Reserve Bank governor, and the Minister of Finance about what they must do to try and mitigate the negative impact of this COVID-19 to the South African people, what are the three things that you would want them to do?
There is something, first of all, that taking on also from what Kubule is saying, that we are not yet studying carefully. The healthcare professionals and other emergency services security are working under protocols of safety. What we have not looked at is whether there are industries, some of them might even be export-oriented, that we could say that industry can be operated safely. Can we not start opening those businesses and supporting them so that people can work safely in those businesses and those businesses start going to work? I think we're starting to have a clear sense of how this disease actually works. So those are some of the things. The other thing that is there is exactly the issue of saying, how do you keep people from being kicked out of their homes, their home loans, their rents, their business loans, and so on? You need to have a banking system that changes this culture to say right now they are going to have emergency measures that rescue and holidays, whether those are 12 months holidays, whatever those holidays may be. But the last small one that I think will be our long-term thing, like Germany, like the USA, our culture needs to prioritize, and I talk about economic, financial culture, and social culture, needs to prioritize the entrepreneur, the people who can create businesses. In South Africa, for 25 years, we've been talking about business, yet small business and family-owned businesses, yet 87% of small businesses don't get any funding from the institutions. And we cannot rebuild from where we are if we don't have a culture, a cultural change in favor of creating new businesses, especially entrepreneurs.
All right.
So that
now,
is,
Mr.
That would be my general direction.
Yes. Now, Mr. Kubule, obviously, when countries are in a difficult situation, just like households when they are in difficult financial situation, we look to commercial banks to get some loans. Now, you know, we were trying as a country to do our own thing without having to go to IMF, right? Now, do you see us going, you know, with a begging bowl for some loans from the International Monetary Fund? As we know, when they do give money, there's normally some tight, you know, terms and conditions that come with that. So my question really is, do you think we need to go to other agencies out there to help us and give us some money to deal with these things? Or we could deal with this internally from the balance sheet that you mentioned?
Yeah, we're talking about the internal balance sheet. I think we can deal with this stimulus internally. And I don't think we should go to the IMF because it comes with punitive conditions that destroyed the economy of Greece, for example, and that have destroyed many countries in Africa and in the 80s and also in Latin America and so forth. But so I don't think we should go to the IMF at all. Yeah. So.
All right. Even if they are offering money on terms that are favorable.
No, they're donor funding. They're donor funds that we can use for health facilities and so forth. So I do believe that many of the, I don't know what the donor facilities that are available that we can use on generous terms to support our health facilities in this situation. So I did hear about maybe some global institutions releasing funding for that purpose. So I will support. Yeah.
All right. And now we just left with about 5 minutes. So I just want us to have, to wrap up the discussion. I'll give time to Mr. Swana to just give us his concluding remarks around the issue of the negative impact of COVID-19 pandemic to the economy globally and nationally, and then you will close it for us, Mr. Kubule.
Thank you. I think that there are lessons from this. First of all, not only are we economically and financially ill-equipped in terms of our mentality for this. There are areas where South Africa had been building a lot of reserves, for instance, the strategic fuel fund and others, where at one point, for instance, in 1988, we had about 18 months worth of fuel reserves in South Africa that we could actually continue without buying fuel from anybody. Those reserves have depleted. In a number of areas, people have fiddled with the balance sheet of the nation and messed it up. But that balance sheet is still good. We can launch a lot from that balance sheet. So my view is that, number one, let's abandon this culture of over-conservatism and trying to run this place in a manner that complies to the rating agencies, complies to the IMF, is going to damage this country. Secondly, we need policies, social policies. For instance, have we really mobilized all of society, is Bonda, Inkosi, chiefs, and so on, to say, guys, this thing is dangerous. Mobilize your people against this thing. I don't think we've done that. Mobilizing the army is something else, but I think people themselves need to be mobilized. Mobilized economically and mobilized. Because, for instance, in the rural areas, we need agriculture to kick up and provide more food security in the nation. So those, to me, including entrepreneurship and schemes to save people from ravaging loans that are unlikely to damage many families in 2020. So I think that is where government needs to focus. And it means the banks need to be brought to heel. These banks have made a lot of money in this country, and right now they need to come to the party.
Thank you very much, Mr. Swana. Mr. Kubula, your concluding remarks?
Okay, I just want to talk about this issue of the banks. You know, in Italy, I think it led the way when they announced the 3-month mortgage, interest, and rent holiday. The government announced it. So in South Africa, we had a situation where the banks were going by themselves. But now I heard disturbing news over the weekend from the people who are participating in the NEDLAC discussion that no, the banks are, you know, they're reneging on that agreement that they made, and they say it's not possible to have a uniform debt holiday in terms of mortgage payments, debts, and so forth. So I do think this is where the Reserve Bank can also step in and perhaps make the banks implement that debt holiday, because you will know that we don't know how long it will take to flatten the curve. We are saying 6 weeks. If you look at Wuhan, it's 2 months. But then most people will say, we can't implement in a democracy the draconian measures that they did in Wuhan. So it may take longer to flatten that curve. And you saw as you resume production in China, you also there's a risk of reinfection. So the possible cycle where you stop the economy, this is a worst case scenario, stop the economy, then you relax, everybody goes back to work. So what people are saying, no, you don't just all go back to work at the same time, you do it gradually to prevent reinfection and so forth. So just basically, I would like to use the analogy of an earthquake. When there's an earthquake, the first priority is to care for the sick. And whatever it takes, you have to provide resources to provide for the sick. The second issue that you do is to provide for the incomes of the people who are affected, some kind of support of the incomes of the people who've lost their houses through the earthquake, and you provide some kind of support to them. That's why you see people living, there's those things in earthquakes. And the third thing, as we resume production, then we also have to have a different stimulus for the economy where we help the nation resume production. So that is how I sequence the interventions here.
All right. So how soon should our president and whoever else that he needs to consult with, how soon should he come up with some rescue package, meaningful rescue package for the country, in terms of getting the economy going again, like what has, because I don't think we have the time.
Yes, we shouldn't overthink it, because a lot of these countries were doing it quickly, and they came out with innovative ways to get the money into people's pockets, which involved information technology and the banking systems and so forth, and you get it on your cell phone or whatever. So I just think that we shouldn't overthink it. We should just agree on the principle, and then let's agree on, but the one thing that we mustn't do compared to the global financial crisis, yes, there's a role for protecting businesses and banks, which might suffer from the situation, but I don't think the public globally is really going to accept another situation where you just go and rescue the banks and you don't rescue the ordinary person. So we have to strike a balance between the support that we give to businesses to maintain production and the support we give to vulnerable people, the poor.
Yes. So, Mr. Swana.
Yes, sir.
Yes. So, to the people in Bizana, what do you say? Should they be hopeful of a better life, or they should just, wait for the end of the world?
No, this is not the end of the world. I actually think this is one of the best things that has happened economically. I think that the people who've had far-fetched ideas that have been misleading us for quite some time now, economically, have now been exposed that they actually have nothing. They don't have any pants on. So we are able now to put forward proposals that I think are going to be new and are going to be fresh. And this proposal must be focusing on the bottom 90% of the population to lift everybody up, rather than proposals that are seeking to support the tycoons and everybody else who's super rich in any event.
Yeah. Mr. Kobule, to the political parties out there, what role should they be playing, or maybe our parliament, what role should it be playing in getting the politicians, the presidency and everyone else to actually move to come up with something that will provide social support? That's the, last question before
I think we should reconvene Parliament, have a debate in Parliament about a special appropriation bill and a COVID stimulus. That's what I think we should have, yeah.
Yes, and how soon should that happen? Obviously, after the lockdown.
I think we should get them back to Parliament immediately, and they should do that immediately, yeah. You saw how quickly the US convened Congress and the Senate to go to discuss that stimulus. It was rushed through, yeah. And it will never be perfect, but we have to do something immediately. Yeah.
All right. Now, gentlemen, thank you very much. I think for me, as a layperson in your space, I've been more taking notes so that I can appear clever when I comment on these matters, But thank you very much. I hope the people who are watching also, derived a lot of value from your discussions. I'm sure it's not the last time that I invite you guys, to discuss these kind of issues. And I thank you for making time. And on behalf of the people who are watching, I'm also thanking you.
Thank you very much. Yeah.
Goodbye.
Thank you. Bye.